Hey, hello everyone. Welcome to Thinking Out Loud. Ricardo, Kristen.
Hi.
Basically, Thinking Out Loud is where we discuss our thoughts on our philosophies and insights, mainly on mental health and entrepreneurship, basically based on our experience with that. We're doing this for Start Day One, which is a nonprofit foundation for mental health and suicide prevention. We just have a more proactive approach in helping people rather than a reactive one where organizations are waiting for mental health issues and suicidal tendencies. Anyway, today we're just kind of taking advantage of this opportunity to get some questions from the audience, asking us, different things about mental health, suicide prevention, or inspiration, motivation, things like that. Anything that applies to your mental health and well-being, really.
We had a guest scheduled for today, but he is sick right now, so he had to back out last minute. And so our original speaker, who was supposed to be here today, is not going to be with us, but we got someone else to join us.
Yes, so his name is Rick Moore, and he's basically studying right now in the mental health field. And so we kind of got him here just to kind of discuss what his insights are, what he's learning, what his thoughts are about it. But mainly, we want to hear from more people. What we're doing with Start Day One, what we're gonna do, and things like that. So please welcome our guest, Rick.
Hey guys,
Hey, how's it going?
it's pretty good. How are you guys doing?
Not too bad, not too bad. So, I kind of gave a crappy intro there. You want to give
It's all good.
everyone a quick intro and like your background, why you're in the field, how you ended up there and what you want to do.
Sure, happy to do so. So my name is Rick Moore. As already stated, I'm a current clinical mental. I'm currently a grad student at NJCU in the clinical mental health degree track, and also I am being certified as a DRCC. DRCC stands for Disaster Response Crisis Counselor here in New Jersey. And so yeah, so I got into the mental health field. Actually, started from very young. My exposure was I'm in the process from a faith setting. I saw how they um, also how people in the faith saw mental health. I felt there was something wrong with it. The fact that it was so spiritually driven and diagnosed, and I knew something was wrong with it. So that's where it started. The questions turned into more so a passion. So that's where I get my start at. And honestly, right now, my desire is to walk with people through their traumas and their issues. The truth is, when someone is going through a trauma or someone's going through a crisis, they want someone to walk alongside them. I don't believe I have all the answers, but my belief is that I like to walk with you and assist you in finding your own answers. In addition to walking with people, I like to educate people on mental and emotional wellness, mental and emotional awareness, two key factors. And I'm just glad to be on the show, be able to share what I can.
Awesome. Much better intro than I did. So yeah, I'm glad to hear that. I like that you're mentioning about walking with someone because we're very social beings, and that's actually one of the most helpful things. Without even saying anything, just because someone is there, it actually helps people recover. And just because when you're with someone, I learned this from Mind Over Medicine. This lady, Lisa Rankin, is the author. And she was talking about us being social beings and stuff. And basically, what she mentioned was that when you have, when you can get rid of loneliness, and basically that's an internal thing, right? You can be lonely in front of 10,000 people and still be lonely.
Absolutely.
So it's very internal. But she did mention that when you're with someone coping with a stress response with someone, you're actually able to handle it better. Just because you're with somebody. And loneliness is, we've mentioned it plenty of times on this thing. It's like, it's kind of like, it basically pretty deadly. It's actually worse than obesity.
It is a killer.
It's like smoking. It's worse than smoking 15 times a day. And so people don't realize the effects of it. I was just talking with someone today about, we always talk about like almost like the physical, the chemical imbalance, things like that, like the physical results. And there's this argument right now: is it coming from that, and then you're depressed, or is it, to us, it's more your perspective, and then you become depressed? So with mind over medicine, one of the things I learned there is just your thoughts alone can actually harm you physically. And not just, to me, chemical imbalance is so minute compared to cancer, right? You'd agree with that, right? So if people are able to cure cancer by simply their mind, because it's been proven, this is not like, crazy talk. It's called the placebo effect. Everyone knows the placebo effect, but no one studied it except for this one lady, just Lisa Rankin. And that's why it intrigued me. And I'm like, you've heard about it. People, curing themselves. I mean, to the point, she said there's studies where people grew hair and they didn't put anything in them. It was just a placebo.
Right.
People getting rid of warts. I mean, that is like physical stuff. Like, that's insanity. And so, of course, you're going to have to look into that. And then we're talking about chemical imbalance. Everyone already knows the amygdala produces that cortisol when you're in that fight or flight, scenario. And so I know the chemical imbalance has a lot to do with the cortisol levels, the negative chemicals that are making you depressed and all that stuff. So, I'm under the impression that I believe it's all about, I'm always all about the cause, not the results of things, right? Like, for example, we had a quick conversation today talking about, where I think depression is coming from. People kind of always mention that the result is the cause, and it doesn't make sense to me. And I'm not sure, what are you being taught right now as far as that goes? Actually, let me get your insight. What do you say or think about people that go, oh man, my depression is really bad today, or my anxiety is kicking in again? Like, what's your thoughts on that? I'm just curious.
Sure. So I will start off with this. Stress causes imbalance.
Yep.
And I'll put it this way. Everybody deals with stress, depression. That's the bottom line of it. But when you don't know how to manage your stress and depression, so there's like a moderate level of stress, depression that comes with the daily tasks. We have responsibilities, we have obligations, so it brings on. And so even when it comes to stress, there are two types of stress. There's distress and there's eustress. When it comes to stress, there's the good type of stress to where, oh, I have to I have a family, so now I have to take care of them. So that stress causes you to get a job. That stress it puts you into a position to where now you gotta make things happen. Bad stress is, for example, when you're grieving and when you're stuck in that place. And so in that place of grieving, whether it's grieving over a loss of a loved one, grieving loss of a job, you can grieve over so many different aspects. When you don't learn how to combat it, and it takes over you into where now you can't function, and now your daily living is off. And so that's where me, as I'm being trained as a mental health practitioner, to look at the present problems, the present issues, and see what areas of life have been disrupted, see how bad. So assessment is a big part of it. So when someone comes to me and I say that they're depressed or they're stressed, I'll ask, due to what? How do you feel? When your stress started, what has changed from before it happened? How has your daily living has been affected? So there's so many different avenues to go about it. You mentioned the term mind over medication. Psychotherapy is huge. And so a lot of times we think of chronic illnesses like schizophrenia, which are lifelong battles. So lifelong battles. Even with that, psychotherapy, talk therapy is essential within that, even that type of chronic mental illness. And you mentioned the placebo effect. just the fact that you're able to think about something, it can change the trajectory of whatever the course is.
Yeah.
So when you talk about, and so this is even now, and I'm going to end it on this. Even now, as we're going through this present time of the COVID-19, and there's so many different domains of our life that's being impacted, there are so many ways to combat it, a lot of
Right.
strategies. So self-affirmation, um, uh, uh, salutations, just speaking positivity over your day to
Hmm.
keep yourself regulated. It's important there's so many different things that you can do, but be able to not only speak it but to believe it. That's a big part of recovery in
Yeah,
so many different aspects.
definitely. Exactly. And actually, I'm going to go back to the other one, but yeah, I always tell people it always starts with the decision, right? That's
Right.
the conscious effort to decide and believe that you're really going to do it. Because until you do that, nothing's ever going to change. And when you expect an external factor to change you, it's never going to work. And I like that what you did before when you mentioned about the, asking a lot of questions. And it's funny because I always compare mental health with kind of like entrepreneurship. Um,
Mm.
Basically, you mentioned that people need to be able to have the tools or the expertise, I guess, on how to handle stress and things like that. And I always kind of mention how they have to be entrepreneurial, right? Even the way you mentioned you asking questions, that's like a sales tactic kind of thing. People
Mm.
look at sales as a negative thing, but for me to help you with what I'm offering, because I'm like, for example, you, right? You're offering help, but now you have to sell that to this person that just doesn't believe it, right?
Mm.
So how do you do that? You have to ask multiple questions. And so in big ticket sales, you kind of have to ask because you have to figure out, well, what is the problem, right? Until you
Right.
figure that out, you can't supply the benefits. And
Right.
you can talk about the features and features and features in business. That's what, people fail because they keep talking about the features instead of the benefits. So when you're talking to someone too, when all you're talking about like features, features, yeah, but you're going to be this and you're going to be in shape. And yeah, you can't sell them. So to me, the main objective is changing people's perspective. The reason I believe that is because I think it all stems from the perspective, and all your decisions follow that. Until you can change that perspective, they're never going to make the decision you want them to because their
Mm.
perspective is this right now, right? And the only time we need inspiration or motivation is to change our perspective.
Mhm.
That's why you tend to watch it. But how many times you get motivational stuff and never act on it, right? Because they didn't change your perspective. It just hyped you up, but yeah, I'm good. It didn't change my perspective. All you did was just do it, Nike style. Like that didn't change. That does not change my perspective at all. But when you start talking about ways that why you should work out or things like that, it's like, dude, just put in 5 minutes of your time. Like, what's the big deal? All of a sudden, you're like, yeah, I guess, yeah, 5 minutes isn't bad. All right, you just change his perspective to the point where like, there's no harm in doing that. So why not? And then once you make that decision, you no longer need any inspiration or motivation. Like you're good. The only time you need that is when your perspective changes again to, man, I really don't feel like it. The weather sucks or something. And so I always think of that, like, always changing people's perspective and asking questions is one of the best things because it has to come from them. It's almost like, no one likes being told what to do, even though they know exactly what they need to do. They know. For example, people that stay in their room, you got to get out more. You got to go outside. They know. Like
Right. Right.
they know. There's no one that went, I guess I should. Like,
Hmm.
how long have I been in here? Like, it's
Mm.
not a surprise to them. But until you change that perspective, it's almost like they're not going to do it. There are
E-
times that you can kind of sort of force it, I guess, and then it kind of works the other way around. It's kind of like when you start exercising, it helps your mindset, and then your mindset makes you exercise more, and then the circle goes it goes this way now, the cycle. Because until you break that cycle, it's always this way. I'm depressed, I eat, I get I gain more weight, and then I get more depressed, and then I eat more, and it keeps going until you go, all right, and then it goes this way. Now I feel better. I'm healthier. Now I'm working out. Because I'm working out, I'm feeling better, and then it keeps on going. And it's this part. It's that
Right.
this part. It's like, how do you get them to turn the other way? And I always focus on that. So that's kind of been, at least from my experience, the best way to kind of like help people, I guess,
Right.
And I know one of the things too that's helped is like, and it's funny, a lot of times it's just really just talking it out.
Mm-hmm.
I don't know what you've been taught as far as like the listening, and what have you been learning about, like, the listening skills and really listening to the client and letting them talk and stuff like that. What's being taught about that?
So there, the if we want to go into skills, the actual skill is called, we use a tactic called free association.
Okay.
Free association is basically to be able to just, the ability to just listen, or the operative word, active listening, to where you're listening not only to what they're saying, but listening to their nonverbal communication. Because we all know it's the fact that communication is, I think it's 65% nonverbal, and then there's another percent is how we say it, the tone of what we say, and then a small percentage is actual words that we use. So being able to listen to every different aspect, the total man, the holistic listening, in a sense.
Yeah.
And I wanted to mention something we said about perspective.
Mm-hmm.
I've worked in so many different fields. I've worked in reentry with those who are incarcerated, those who are leaving prison. I've worked with those who are in substance abuse clinics. And perspective is the main, I would say, the main key to unlocking or reversing that negative and maligning cycle. And one thing that I share with them, and if you speak to a counselor, each counselor has a therapeutic orientation, which basically that means is their guiding theories, a theory that they use to guide how they approach a certain situation. So my guiding theory is RABT, Rational Emotive Behavioral Therapy. And basically what that means is perspective is everything. They have a model, it's called the ABCD model. A stands for the activating event, B stands for the belief, and C stands for the consequence. So I'm going to use ABC for right now. And a lot of times we go from A to C, activating event to consequence. We think that because something happened, this is what caused my reaction. No, it was the belief of what happened that caused your reaction. If I would have passed by you right now and stepped on your shoes, and you lashed out and got frustrated, it wasn't that I stepped on your shoes. It was because you believed I was disrespecting you. And that's what causes you to react. If we are able to stop, and so we think about, you asking me what I'm being taught, thought stopping is a technique that we learn in one of our theories in CBT, cognitive behavioral therapy, learning how to stop those negative thoughts. And one thing that I'm being taught is to teach people, well, first I have to learn it myself, right? I can't just sell something if I don't take it.
Right.
So I have to learn it myself. So what I'm doing, especially with this COVID-19 and what we're in right now, it's causing me to self-reflect. Now that I have a lot more time to myself, and I'm able to, in the sense, this is like my time to reevaluate and to transform a lot of things in my life that, this is an unhealthy habit. Let me change that. And so thought stopping. Now that I have more time to myself, I'm hearing more thoughts that, okay, this doesn't sound right. This don't sound, and so when I'm able to stop my thoughts and to evaluate, why am I thinking that? And what started that thought? What happened in my life that caused me to think this certain way? That helps me to find the root. And therefore, if I can uproot the problem, then I can better my life.
That goes back to the remedy, the cause, not the result.
I was just about to say exactly that. And we had a quick conversation before about my theory. I'm just like, dude, everyone is always trying to remedy the result. not the cause. And I like that you always mention, so you're going to do well out there, dude. So, no, because
they're teaching them the right things in school.
Yeah,
which is awesome to
the
know.
biggest thing is, first of all, you have to care. You have to give a shit, right? Or else you're not going to listen. You're not going to hear the right things. You're going to hear what you want to hear, all that stuff. You really just have to care, first of all.
Right.
And one of the things, actually, this is our theme color. It's teal. So basically, it stands for what you can give to help in suicide prevention and mental health issues. So it stands for giving your time, effort, attention, and love, right? And, you know, we always say this, and I almost always have to say this in every episode because people, I never know which ones they're watching, right? And like I mentioned before, they always see the result as the cause. To me, it's kind of, I don't know, it's like lunacy, you know, because they just kind of come up with this idea. And I'm kind of curious what your insight is, right? So people always come up with this thing like, oh, my depression is really bad, or my anxiety. And you kind of mentioned before, but that's just the result. That's the response, right? Because of your perspective on, I don't know what it is, but somehow you're causing yourself to be depressed. Your negative perspective is getting you depressed. Well, guess where you're at now? You're in depression.
Right.
The doctors and organizations, I mean, these are suicide organizations, are saying it's this way. Oh, you've got depression, Rick. That's why you're depressed. And I bet you have bad perspective. That's not how it works at all.
Right.
It's always the other way, because it's impossible to feel like shit and have a great perspective. It's impossible to have a negative perspective and be happy as hell. It is impossible, right?
Right.
So that's always the cause. It's always. It's never like sometimes. No, it's always. It never just hits you, depression. And so anyway, everyone's trying to remedy the response. That's just the response. Oh, here's pills for that because your heart's beating fast. Like, let me give you anxiety pills. Like, yeah, but I'm just responding to my perspective. That's all that is. And so to me, I'm like, you're not remedying the cause at all. Like, you didn't fix the problem at all. It's kind of like having a leak in your house, right? And then you have a carpet that's wet. And then you keep replacing it with the best carpet. Yeah, but this one will now last longer. It won't get as wet if you put this on. But you just had to plug the hole. Like, I'm not sure why you keep getting new carpet. So to me, it's always trying to remedy the result. The pills, the rehab centers, all these efforts, not that they don't help. It's great, but it's temporary. It's kind of like alcohol. Alcohol temporarily relieves them of their stress. It's the way to numb the pain, right? It's the way to numb their thoughts. Their perspective becomes, who cares, right? That's why they go on drugs, and they go on, they lost their bonding experience to the point where they can only bond with alcohol and drugs or sex, gambling, things like that. Because people that think it's a physical thing, it's like, well, you have to explain to me where they shoot up gambling. Like, I need to know, because that doesn't make sense, right? It doesn't hold water at all. Like, your argument's not going to stick if you think it's actually the alcohol. And remember how we were talking about the belief, right? If you believe that the problem is the alcohol, you're always going to have a problem. Like,
absolutely.
Always. Like, always.
The alcohol is the result of the problem.
Right. Because I'm pretty sure it's not the alcohol, because I've been drinking.
Absolutely.
And I'm good. Why is that? It's not the alcohol. And the thing is, I don't disagree with letting go of it if you want to be healthier. Well, yeah, I'm not drinking while I'm working, but that's just something you have when you have a good mental state of mind. When you have a bad, when you're unhealthy, you just want to drown things out, and you just don't want to actually go into the next point. You just don't want to be accountable. The biggest thing I've learned when talking with people that are in a bad state of mind, man, is that they love excuses. They hate accountability. Like,
right on.
And the thing is, we all been there. We have all been there. That's why I know it's not because, I'm awesome. No, it's human nature. Like I like that you said before the response, and I tell people like, I don't know when it became abnormal to be depressed. I have no idea when.
It's just to get depressed.
It's a natural response so that your body can cope with your grief. DABDA, right? Denial, anger, bargaining, depression, and then acceptance. The only positive outcome of the whole thing. Right? Until you get there, you're taught you're going to jump from one to the other. But once you get here, boom, you're good. Like you're good. You may go back here and there a little bit, and people think it's a problem. Like I saw this one post, a neighbor killed themselves or something. So this person was like writing in this, like, please help. I don't know what to do about this. And I'm just like, someone committed suicide next door. You're supposed to feel weird. Like, I don't understand why people think that you shouldn't feel like Grinch style. Like I can feel, like it doesn't make sense to me. So I'm always trying to teach people like, and once you change their perspective and belief about it, it's like, why are you like this lady approached her? I may be a little off today, because I just lost my sister, right?
Yeah, and so I said to her, I'm like, well, you're supposed to be sad and depressed right now. You just lost someone that you cared for. Yeah. Like you're supposed to be sad. Yeah. She thought she was supposed to be like in a great mood because she was out at, at a festival or a convention or wherever I was. And I'm like, yeah, but you're supposed to be sad. Don't you know that's normal to be that way? Like, you can't get rid of an emotion. Depression is an emotion, a feeling.
Right.
You can't get rid of it. You're supposed to have it.
Yeah. And so just that alone, that's where all these problems begin. At least we think so. Because when they have that mindset that that's abnormal, well, yeah, you're going to seek help. But to me, it's like, why?
Well, because I think doctors are telling people nowadays that, well, depression is abnormal. You've got problems. So here.
Anxiety is also abnormal now too. Looks like he paused. Yeah, and anxiety is abnormal now too. Basically, every negative response we're trying to cure, which is crazy for me. Soon we're going to add anger to that. We all know being angry is bad. There's going to be angry pills.
Well, there are. Those are for people who are like bipolar. Those are people with anger issues pretty much, right? So there's pills for that. So they're trying to cure anger. Like you're supposed to get angry at things. It's an emotion. It's a feeling. You're supposed to have these emotions. You're just not supposed to just live there all the time.
Yeah.
You're supposed to.
Right. It's part of the process. Yeah. It's basically
it's part of the process of being a human.
Exactly. So I hope that's all making sense, right? Like when you say it's abnormal, right away, it's gonna amplify the issue, right? Once a doctor
puts a stigma to it.
Yeah.
Especially coming from a doctor. Now we're going into the nocebo effect. When people actually follow what they've been told, biggest example is when doctors tell cancer patients, "Oh, you have 3 months to live," and as soon as they believe that, they actually die in 3 months.
Rapidly, right?
My grandfather had pancreatic cancer, and they told him the day that he was diagnosed, they said, "You are going to die in 6 months." 6 months to the day, my grandfather died.
Yeah.
To the day, from the day they told him it was going to be 6 months, he died.
Yeah, wow. And so
that's all.
Right, and so that's why I have such a strong belief. Whenever someone tells me, like, "Yeah, but you have to consider the chemical imbalance," we have to figure out first, is the chemical imbalance the result or the cause? There are some situations, but you're assuming all situations, though. That's what I don't like. My brother's in a hospital right now, and I know it's not just like, well, his perspective sucks. I think it's just a long term of it. Oh, he just dropped. Looks like your camera turned off. But but that's what we have to kind of.
I'm sorry, I'm working. Give me 1 second.
Yeah, sure. Yeah, but that's really our issue with that. Like we have to kind of have a discussion on whether or not, the chemical imbalance is coming from, the result or the cause. So, Yeah, we're not sure what happened to Rick here, so it's kind of off right now. Um, any questions from anybody at all? This kind of we just wanted to take advantage of getting more questions. Actually, it would be great to just figure out what people are thinking, uh, and what they're learning out there, what they're being taught. Anyone on Instagram want to chime in?
I don't know if you're still there, Danae, but hey, Danae.
What's up, Danae? So
Well, I guess we can just do a quick little thing about these guys.
yeah.
Real quick.
So one of the things we're doing behind the scenes, we've actually partnered up with Eyes on New Jersey just to increase our exposure and reach more people. And it was cool. Jordan from Eyes on New Jersey reached out to us and really just wanted to, do his part with being part of the suicide prevention and, basically the whole mental health. He just recently lost some friends and stuff like that. So it was cool of them to partner up with us, and hopefully we can help them with different content by, our efforts in raising funds to really produce content that can help inspire and change people's perspectives and basically their lives. And so that's kind of the whole goal. And if you text start day one to 44321 to donate, it'll help us kind of raise money that'll help us to get more people, get more speakers, get more influential people to spread the word, and just really educating more people about what we're talking about, because we just have a feeling that we're being taught the wrong things and it's making matters worse.
Definitely.
And it's a pandemic. Actually, was it Rick that mentioned it? I'm not sure. Was that you that mentioned that? I think it was a conversation I had, that people are so concerned with the pandemic about how many people dying, but probably like, I mean, I don't know how much, but it's definitely a lot more that are going to die from suicide. But no one's panicking about that. Like,
Yeah. Yeah.
But they're panicked about, like, oh my God, 100,000 people dying from the pandemic. Yeah, but there's like 500,000 on suicide. Like, but no one's panicking.
Because of the lockdown and everything.
Well, actually, it's going to increase because of the lockdown.
Definitely, it has already.
Because loneliness, it's a killer. Now that you're stuck at home
and people aren't being social, they can't go out to work and talk to people,
and then
do
less
their
and less
things.
And we're very social beings. The less we're being apart and bonding, these bonding moments, that's what's important. And sometimes bonding like this actually works, but being able to share stories and things that that can just increase that bond with somebody or something.
Absolutely.
That's what helps. So, and when people feel stagnant every day, they're just at home and nothing, no progress, no upside, and that's why we kind of
Groundhog Day every day.
Yeah. Well, we're hoping people go groundhog on us, read the books, practice something that you can get good at. And there's actually sort of like a backlash on that. Like, people are saying, like, so many people are, basically they're making people feel like shit if they just want to chill and Netflix all day, And the thing is, like, hey, I'm all about balance, man. Or really, it's more a harmony. Like, it's all right to chill.
We haven't yet, since this all started.
Yeah, right.
We haven't yet.
Just don't chill too long,
Right. Like, it's cool. Go ahead.
Yeah. And so what are your thoughts? I was actually talking to this one person. What is it called? TMS? Forget what it stands for. It's some new therapy for depression.
I forgot what that was called.
It's like I guess electromagnetic something. They just kind of put it on your head. You sit down on a thing, and basically it alters your brain somehow. It's kind of sketchy on my, I don't know much about it, but according to the website that I saw, it has less side effects than obviously bad side effects of antidepressants, basically pills. So I'm curious what that's kind of about. I'm still kind of, not that it doesn't help. It's like there's diet pills that help, right? But I just feel like that's just remedying the result. Because, you could be exercising, but if you keep eating, well, you're never going to get there. So it's almost like you can meditate, but if your perspective is still, or you just have never forgiven your dad, you're just going to get better, man.
or yourself. It's called TMS, transcranial magnetic stimulation.
Yeah. So we're hoping to have him as a guest to kind of explain that, because supposedly on their thing, they have a good response to it, So I'm like, wow, what does that do? It's altering things. But I'm curious if it's mostly a placebo thing where they know it's helping or think it's helping, because some people that are on antidepressants know, like people are actually scared to take antidepressants. Like they're like, oh, I don't know.
Yeah.
You're like, I'm going to be stuck on this. Like, I don't want that. Or, their fear of addiction to it, things like that. There's those fears.
Especially if someone has an addictive personality. If they are an addict or were once an addict, now they're going to be addicted to, some kind of antidepressant,
right?
Whatever they are. I don't even know what they're called.
Yeah. So it's a funny subject because, to me, it's once you have that philosophy, right? Isn't it hard to see now? Like, every time it's just trying to remedy the result, like it's you have to get to the root of things, like what you're doing is great.
Absolutely.
There is no way you're going to get to the root of the problem or the cause unless you ask the questions,
right?
Because until you know, you won't know. And the cure, you're not even curing them. You're actually helping them cure themselves, because that's all they really need.
Right.
You don't give them anything to cure. They have to cure themselves, because
they have to make the decision.
They have
to make the decision.
And also, like Lisa Rankin on that book, Mind Over Medicine, actually mentioned, it's like our body has the best, basically, like it's how did she put it? It's like not a self-defense mechanism. Like it just knows how to fix itself. And it's when you're always in stress response that actually messes you up. That's kind of like putting miles on you. You know what I mean?
Right.
Until you go into a relaxation response, that's meditation. That's when you're in a good place, chilling on a beach, relaxing. That's why meditation is so good, because you go into this relaxation response, and that's actually the only time your body can cure itself. When it's in a stress response and you're worried about bills and you're worried about the future, or you're dwelling on the past and things like that, stress response. So cortisol, all of a sudden cancer, all of a sudden blood pressure, all of a sudden you start getting all these physical issues from your mindset. It's insane. And so that's really the only time to get better, and that's why, until kind of like I learned something else, right now I'm a strong proponent of that idea that we have to fix ourselves, and that's really where it comes from, right?
Ricardo, there is a saying in the profession, and I'm sure it's in every field you can think of: the practitioner or the doctor can work harder than the patient. And if you find yourself working harder than your client, it's counterproductive.
Yeah.
And so that's the first aspect. So it's going back to the assessment part. What's the problem? How severe is it? And it's so vast, because there are so many responses to a problem. And this is where, for example, we may have so many theories on how to solve a specific issue. We have so many medications, because not everybody's the same. So just like with medicine, based on my bodily structure and based off of my how I'm constructed, I may react to a drug different than how you may react to a drug. So same way, mentally, the way I may react to a theoretical approach, I may need more psychoanalytical approach. I may need to go way back. We call it there and then type of therapeutic modality. I mean to go way back. Or I may be more prone to a here and now approach where let's deal with the problem here and now. What's going on? But again, everybody's different based off of their construct and how they're structured or
Yeah.
how they're constructed.
Yeah.
And so, yeah, so there's so many different aspects to it. And it's so true how we have to look at what is the main root. But the interesting thing about it, and then you talked about drugs, and we talk about substance abuse. A lot of times, the main issue when we start to compound it with other issues, that becomes the main issue. So let's say, for example, if I'm going into if I'm at a clinic and I'm speaking to someone who is a heroin addict,
Mhm.
I do have to deal with the underlying issue. But however, before I can deal with the underlying issue, I have to deal with the issue that they created due to the underlying issue. So
Yeah.
now there is that aspect of withdrawal and all that. And to be honest, when you're dealing with someone who is on drugs, you're referencing drugs and whatnot for a bit,
Yeah.
a person has to be sober at least 2 weeks before we can even deal with the main emotional issue.
Yeah.
So when we don't know how to manage, and that's the main thing, taking ownership and not knowing how to manage.
Yeah.
We may not have known someone. No one may have taught us how to deal with stress.
Yeah.
No one may have taught us how to deal with
Yeah.
anxiety and deal with being alone.
Right.
Right.
And
A lot of people. Yeah.
yeah. No, all good. All good. Sorry if I cut you off.
No. Go ahead. Go ahead.
I just wanted to say something right before I forget it. And it's funny because, when we talk about this stuff, it always has to start off. You have to give them, like philosophically first, because you can give them all the tools and all this and all that, the what can help them manage. But if their idea is still, it's the drug and it's addicting, so I can't get off, I can't do it. Well, let me give you some tools. This is what you have to do. But if their mindset is still, it's the drug's fault, it's never going to get fixed.
Right.
Like
Right.
ever. So I always say you have to go all the way here first. And then you start telling them about how to remedy the cause. Because if you just concentrate on remedying the result, like, for example, like if I went up to you like, man, every time I approach this hot chick, my freaking anxiety is just,
Right.
freaking thing goes up. Like, oh, dude, you need pills for that. Like, wait, every time you do it? Yeah,
Right.
every time I approach a hot girl. I don't know. All of a sudden my heart starts pumping and this. Oh, then let me give you the pills. Like, so this is what you do when that happens. You got to do this. You got to breathe. Yeah, but the only issue was, man, I'm going to get rejected. If I do that, I'm going to be a loser. That's the problem, because there would be no heart palpitations if you just knew, what have you got to lose? Approach her. You might end up getting married. So
We did.
that's kind of, right? And that's how you remedy the cause. But people keep talking about the result. My heart's pumping and this, high blood pressure. Well, what's causing it? Like, what's causing it? I can give you all the freaking tools. I can give you all the management things on how to deal with heart palpitations and stressing out. But why don't you get rid of the cause? Because it's going to keep happening over and over and over again. I'm never going to get rid of it. And if all I learned was how to deal with the stress, what's causing the stress? Why don't we talk about that, right? What's causing the stress? One of the things that Lisa Rankin, how she went into studying this, she had these patients and she didn't know what the hell was wrong with them. There clearly were issues, but she couldn't freaking diagnose them. But she could see like something's off. And so she started a different approach. She started asking them weird questions.
Yeah, she changed like her intake form. Instead of your family of histories of diabetes, the standard questions that you get asked at a medical office: history of diabetes, history of cancer, history of all this stuff.
Yeah.
She started asking like way off non-medical questions.
Yeah. What do you think you need to be better? What if there were no rules in the world? What would you do right now? Oh, I would leave this job. Oh, I would get a divorce. she started realizing, like, oh, see, what's funny, no one talks about this. What is causing the stress? They just talk about, this is how you handle stress.
Right.
It doesn't matter. You didn't fix the cause, like, whatsoever. If the cause is a bad relationship, let's say, but all you're looking at is the result. You're stressed out, you're complaining, you're this, and your chemical imbalance. It's like, well, yeah, why? Of course she would be. She hates her husband. Like, those are all perfectly normal responses. I don't know what's abnormal about it is what I want to know. Like, what is abnormal about it? This kid is thinking that his dad sucks and treated him like shit and punished him and this and that and this and that. So he's drinking his ass off. What's abnormal about that? Nothing at all, because his perspective is that, until you tell him, like, yo, listen, kid, I know you got treated like shit, but you have to think you're just a puppy, and that's, don't grow up to be like that, because your dad was just a puppy too. I'm not sure what your dad went through, but his dad did something to him. And so don't take it personal. When you have that perspective, it's like, oh, he didn't do that on purpose. No one grew up and said, I can't wait to punish my kid. Oh, can't wait to make him feel like a loser. It's going to be great. Ever. Said no one ever. But when you change someone's perspective on that, oh, dude, I can succeed. So it's not his fault. It was all me. All of a sudden, accountability. They're okay with it. And that's where you start getting better.
And forgiveness. Until
you do that, I can give you all the best freaking things that they do out there about handling stress and handling anxiety and handling, suicidal thoughts. Like, if you have the same perspective, you're going to go back, right? And that's why, and people always go like, oh, I've been dealing with suicide since 2016. I'm like, well, what's changed? What have you been doing?
Right.
They're doing things, but they're just trying to remedy the result. And when they feel that way, what do I do to get rid of this feeling? That's it. And that doesn't cure anything. And so to me, it's getting worse. And you know what's funny? Like, I was talking to that ultra marathon guy. He's going to be one of our guests. He's awesome. He mentioned to me, like, do you know the inspirational, motivational industry is like billions of dollars now, right? So much more access to getting inspiration, motivation, and so much more access for help, suicide prevention, alcoholism, all this stuff is all available more. And suicide rate is higher.
How does that even make any sense whatsoever?
How is that possible? That doesn't make sense. Why does it? To me, it makes sense because, well, yeah, because we're making them worse. Like the doctors, suicide organizations, they're blaming it on this invisible freaking enemy. Oh, it's depression. That's why you're messed up. Well, now you have millions of these people running around.
A reason.
They give them an excuse. They can no longer be better because this invisible depression, like as if it comes out of the air. It's when you have that mindset, all your patients, if their mindset is, I have anxiety and that's it. I wish people would kind of talk about the cause of the anxiety. So for example, if people walked around like this, instead of saying, oh, I've been dealing with depression since 2016, if they said, man, I've been dealing with the loss from my divorce since 2016, different story.
Different perspective.
Different story. Because that is the cause. And now you know, like, oh, we have to teach you how to let go of that. But when you just keep talking about depression, invisible, nothing. There's no one to fight.
Because there's no cause. You have to find out what the cause is.
A cause is always a verb. It's the way you're thinking about your divorce, the way you're thinking about a lost one. Until you change that, well, yeah, you're going to be on pills forever. Like forever. Right?
Right. No, absolutely. And what's your support system look like? That's a big question for me.
Yeah.
So when someone comes in and they're saying that they're going through this, is not only in educating them on their situation and looking at what's causing it, but how is your association, your company, those who you're around.
Mhm.
And I think that's a huge part in having that
Yeah.
support. So when we deal with drug recovery and dealing with that, we usually invite in the family. We invite in those who are around them to support them. For one, to help them see what they're going through, to see it from their eyes. Because
Yeah.
again, they're looking at it's the drug, it's the alcohol.
Yeah.
But if we can empower their circle and to help them in their recovery, that addict or that alcoholic or whoever the person that's dealing with that issue will have a better chance in fighting off and better success
Yeah.
rate
And
if
I
you have
think,
that good support system. All right.
yeah. And I think for that to happen, when you have I hate saying camaraderie.
Camaraderie.
Yeah. That word, I don't know. I always have a hard time saying that. But anyway, to have that, for this to be successful, the whole support system,
Mm-hmm.
it all starts with letting them know that they are accountable.
Mhm.
Until they know that and the blame is somewhere else, it almost never works. And this is what I mean. All inspirational, motivational people, one of the biggest advice, stop hanging around with negative people,
Mhm.
right? What's funny
Mhm.
is if you really think about it in the mental health aspect of things, those people have mental issues. They're the only ones that complain. When people look for signs, that is a sign. But we're taught, leave them alone. The thing is, people with mental health issues have to take the accountability that when you have some kind of mental health issue, that you have bad traits. Basically, you're annoying.
Mhm.
You're a negative toll on other people. Until you understand that and that it's you, it's almost so difficult.
Yeah, you're the one that needs to change, not everybody else.
Right. People
Mhm.
think, well, I went through a loss, so you have to adjust to me. Like, I'm the one with depression. You don't, so you have to adjust to me. Like, and I'll actually, it's okay for me to be pissed off at you.
Or
Like,
mean to you.
that's not how it works, like at all. So unless they can take that accountability that it's all them, it almost never works. It never works because everyone's to blame. Society, it's because we give them the best excuses. Oh, they take out that card all day, like, oh, I have PTSD. That's why I'm drinking. Like, what?
Right.
I have what? What do you say against that? Oh, okay. Like, no one says anything. They're like, oh, okay, gotcha. But I'd rather them say, what caused the PTSD? I'm still having a hard time letting go of my friend, so I'm drinking. Oh, well, you should think about that. Like, you should let that go. If you keep saying that over and over and knowing what the cause is, God, it's so much better. So much better.
Mhm.
Because now they know that it's their thoughts that are pulling them into the depression, the anxiety. And I always mention it this way. It's all about numbing the pain. People are addicted to drugs and alcohol, right? At least that's my perspective.
Mhm.
And people are trying to drown out the pain. And I get that. People don't mean to be mean when they're in a bad state of mind like that.
Mhm.
It's just that they're distracted by the pain. One way I try to relate with that is it's kind of like when you have a toothache, you kind of become a dick because you're like, oh, can you please get the door?
Yeah.
Like
Yeah.
it's not that you were mean or took someone for granted. You were distracted by the pain.
Right.
So that's how these people are that are having these really strong issues, especially like PTSD, traumatic, stress disorder. So it makes sense. My problem is this. Your toothache is because you have this hammer and you're going like this. And the pain, yeah, you're getting distracted by it, but you're doing this.
Right.
Stop kicking your own ass.
Right. Right. Right.
Do this and the pain will go away. But you keep doing it. I don't know why. but they have to know that they're the cause, because anything from the past, no one is hurting you anymore. It is all you.
Yeah, you're allowing it.
From there on,
continually hurt you.
right? Whether it's any kind of trauma, the trauma's gone. Like the lion left, but your cortisol level is still going because you think the lion is still right behind you the whole entire time, even though you're out of danger already. And so your physical, your mental is just it's just going downhill, right? Because of your perspective. It's shot. And so when I tell people, when they know that it's them, then you can help them. But until you get them there in the beginning, and you have to let them know this. And, it's kind of good that you have such I think you have like I think you're just a caring person overall. And I think that's why you kind of want to do that. And I think that's what's going to help, because you're going to get to the root of things, and then you start fixing them, like get to the point. But until you change their perspective on the situation first, don't give the features.
Right.
Don't give the features, the benefits. Like, what's the mission of this company? When you buy things, you figure out the mission, it changes you, right? You have to create that, like not goals. I don't really like when you set goals. It's really as long as you have progress.
Day one.
If the goal is here, but you went up to here, that's okay, man. Like you're still better than where you were. But people go, oh, you didn't make it. Yeah, but he's so much nicer. He only drank 2 beers today. Don't punish him because he didn't.
You're hitting on a very important point when it comes to progression and being able to this is where I'll work with the client, or someone who's in the mental health field works with the client, and not looking at it from A as being a drunkard or whatever to B not drinking no more. Yeah. If you were drinking 12 beers first week and we're working on making it progression, if you drink 11 beers the next week, that's progression. That's good.
Exactly.
If you drink 9 beers next week, at least we know, at least we can see, the data is showing that there is progression happening. Exactly. And here's the one thing that we teach in recovery. It is a selfish process. It's a selfish process because you have to take ownership. The key word we use, ownership of your own life. Yeah. And of course, your family, your friends will enhance, and they'll be glad to see you grow. But you can't do it off of the happiness of someone else. You have to want it yourself. So we talk about in the field stages of change. And so when you're talking about with someone, this is a stage of change. State of change is pre-contemplation, when someone's not even thinking about changing. What I'm doing is not a problem. And then you have contemplation. Hold on. You're thinking about it, but you're not ready to make that step yet. Yeah. And then you have preparation. Now you're getting in the step of I'm making a change now. And then you have action. You're putting steps to making a change. And then you have maintenance. Now that you are on the right track, you're maintaining where you are. Right. Now, one thing that people don't talk about with the stages of change is relapse is usually after the action, the maintenance part. And the stages of change is not linear. It's good that you can maintain it, but a lot of times it's cyclical, because if what caused you to go and drink was this breakup or whatever it is, you're doing good. And then you fall into a hole again. If you fall into fiscal issues or someone in your family passes away, this is where you may fall back into it. But this is where we as counselors empower you, so that when you do go through blows in life, you can fall back on the tools that we give you, and you can pull yourself up.
Right. And what's funny is now that you just bring that up, and when people focus, again, it always goes back to the cause and the result thing. They consider those triggers. And when, again, I have to emphasize this. The cause is never a noun. Ever. Ever. A bad breakup, that's a noun. The breakup is not what did it. is not what's
Right.
causing you to drink. The way you're thinking about the breakup,
Yes.
that is the problem.
That's
Not
the
breakup.
problem.
People break up all day, every day. It is not the freaking breakup. It's your thought patterns. It's your perspective. And one of the ways I try to tell people to change their perspective on breakups, just as an example, when they're really heartbroken and this and that, and they, really love the person, dude, if you really love that woman, you should be happy for her with or without you, because you couldn't do it. Period. If you don't do that, well, you don't really love her. You're just really selfish because you want her for you. That's it.
Mm.
You think you deserve her and all that stuff. Like, well, that's why you're in pain, because of that perspective.
Mm-hmm.
And so it always boils down to me every time. It's all about their perspective. It always goes back.
Right.
That's the
Always about
cause.
the perspective. Right.
Right. I can't seem to, until someone gives me another new information that goes, oh no, it's this, then okay, then I'll believe that. But as of now, it always goes back to this. I don't know why. It always, every time I set up a scenario, I'm always like, yeah, but it's because they have this freaking perspective that they're a loser, or the breakup sucks, or who am I going to find ever again? Like, that's the mindset. That's what gets them all crazy. If I told you right now, like, dude, you're going to marry a model in 5 years, done. Breakup's not even nothing.
Yeah, right.
Nothing. Nothing. Not even an effect. So it's not the breakup, So, well, it looks like we're over the hour. Awesome. We actually had a great conversation with you, Rick.
Absolutely. It was amazing. It was great.
Yeah, I was actually hoping to get more questions from the audience, but a lot of people just leery getting involved with mental health, I think. It's like...
But this is what we're trying to do. We're trying to get it out there and put it in everyone's face.
This is why this is so important, right?
Exactly.
Yeah. And so that's why we're hoping, if people could just, help us, just donate. Text start day 1 to 44321. Help us raise some funds so we can reach more. Right now, the best way with the pandemic is reaching them online. What we're doing, this is the best way to scale. This is the best way to reach more people. And just if that one person just saw or heard everything we talked about today, I bet you we could have fixed a lot of drug addicts today. Right?
Just help them a little bit, something,
Yeah.
Change one person's life. It's all that matters. It can one at a time.
Yeah.
You just have to change one person's life.
Because another thing I've learned is, like, sometimes it is so much more effective when it's indirect. When you're telling someone, hey, you're this, you're that, the wall comes up, defense, all that stuff, right? But when it's like they just went like this, or they ended up on the internet and saw something, it's so much more effective. It's like everyone wants the idea that it came from them, not because someone told them to.
Yeah.
Right? And then because all the changes has to come from you. So yeah, so it's funny. So that's what we're trying to do with this whole show. So I'm glad you participated and helped us out. It was good to learn a couple of things that you mentioned.
And I'm glad that they're teaching you, like, the right things, or at least the way that, the things, not the right things, but the way that
I'm glad as well. Yeah.
Yeah. I'm glad. No, I'm glad, because it's, I think back in the day, years ago, when these doctors now were in medical school, they weren't taught these mechanisms, these ways to deal with things or handle things. And, I think they think totally different. They're like, well, like they all do. Like, here's some drugs and see you later.
Yeah. And so this is why we have this freaking strong fight, because we're fighting against a huge different philosophy, a huge, different practice, they just give them drugs, man. It's insane.
If I could say one more thing, and it goes right back to the very beginning, the power of listening.
Yeah.
The power of communicating.
Yes.
I think that can save a lot of lives.
Yeah.
How are you doing? That can save so many lives. Whoever's listening to this broadcast, whether you're watching it after it's done live, if you can just call someone and just ask, how are you doing today? And really listen. Not just listen to, I'm doing good, and then get to your business, but just call with no agenda, just to hear what someone is going through and to hear their day.
Yeah.
And a lot of times it's those last seconds that can help someone before they take their life. It's those last seconds. If they know someone is there and someone can hear them, that they're visible,
They
Yep.
go
That's
skirt.
what saves lives.
Absolutely.
Right, exactly. I totally agree.
Absolutely.
Well, that was a great way to end this session.
Totally was.
Thank you again, Rick. We really
Thank you.
appreciate
Yeah, thank you for being
everything.
here.
Putting
Thank
in
you
the
for having
time.
me.
And then last minute, appreciate it.
Yeah, I hope you enjoyed your time on the show. So, hey, maybe you'll come
Absolutely.
back when you actually learn more and get your own patients and all that stuff.
I'm looking forward to it, man.
That
Thank
would
you
be
guys so much.
great.
Us
Awesome.
too.
Hey, have a great weekend. Enjoy. Until next time.
Until next time.
All
Thank
right,
you.
see you guys.
Bye.
Well, thank you. You.